Hello and welcome to the Alabama Public Health Training Network. I'm Renee Carpenter, State Social Work Director for the Alabama Department of Public Health. Thank you for joining us today for our program, Ethical Standards in Social Work Documentation, from Process Recording to Risk Management. Continuing education credits have been approved for social workers for today's program. In order to receive credit for this training, you must watch the entire program, then complete and return the social work test, sign-in sheet, and evaluation. While content may continue to be relevant, continuing education credit will only be awarded for 2 years, expiring on May 31st, 2019. Now let's get started with today's program. So I want to open with the standards of professional conduct and ethics, especially focusing on the areas that sort of revolve around documentation, or where we can actually get tripped up on documentation. In Section 2, which is called the Social Worker's Ethical Responsibility to Clients, Part C is confidentiality and privacy, and Paragraph 3, the social worker shall keep timely and accurate records detailing problems, treatment plans, scope of services, and dates and content of client contacts for a minimum of 3 years after the date on which services were last provided to the client. So records shall be securely kept to ensure the confidentiality of clients. The records or other oral or written information which personally identifies the client shall not be released to third parties except in specific circumstances. Now this is not necessarily specific to ADPH. We have our own policies related to record retention. However, I want to go back to the very first part of this where it talks about timely and accurate records detailing problems, treatment plans, scope of services, dates, and content of client contacts. Now, it's a very wordy, but I want you to remember that your SSRs are also part of the record. So keeping timely SSRs and timely documentation is critical. The closer we are to the event when we document, the more accurate that event will be. Now, there's a 5-day limit on documenting your documentation, getting it completed and in the record, but there's really a very, very tight time limit on SSRs, and that's because that's our timesheets. That's our bill that we submit to Medicaid. Therefore, the SSRs are supposed to be kept up with daily. They are to be completed daily. Now, there are times and circumstances when at the very end of the day you won't be able to get that done. You may finish your day out in the field, and that's perfectly understandable. However, the SSR at that point needs to be completed no later than noon on the following day. Okay, for many years, the purpose of documentation in social work was to accurately record the diagnosis, the assessment, the planning, and the intervention. If we look all the way back, say 50, 60 years ago, everything was handwritten and it was documented pretty much as people did it, and it was very abbreviated. But it was accurate. But beginning in the mid-1990s, documentation became key in record review and in utilization of managed care when it came in. So what we had to do at that point was basically the documentation, of course, had to be accurate, but it also had to justify what we were doing with our patients and how long they could stay in a facility, for example, or what services their insurance would pay for. So the purpose of documentation sort of has evolved over time. More recently, it's become very clear that documentation is relevant to risk management. Now, risk management is not only on the patient's behalf, but also on the worker's behalf and the agency's behalf. For one thing, it guards clients' privacy. We've got to make sure that whatever we record is kept secure, it's kept preferably locked, but at least kept where it's not out in the open, it's not easy for someone to see or have access to. We also have to facilitate the delivery of high-quality services through our documentation. think of it this way. Sloppy documentation is often equated with sloppy work. So how you document what you did is automatically viewed by someone else as the quality of work that you provided. It also provides a defense against ethics complaints. It could actually get, if a patient has an ethics complaint against an employee, their documentation is what's going to be pulled to defend their actions. So again, you want it to be timely, you want it to be there when you need it, but you also want it to be accurate. It also can serve as a defense against professional negligence. So not only is it a defense against an ethics complaint, it can also be a defense in court. So what are the contemporary functions of documentation? First of all, assessment and planning. That's where we start. Secondly is service delivery. That's where we carry out our plan of care. 3, it serves as continuity and coordination of services. What happens if you go home today and you get sick over the weekend? Then who's going to pick up that chart and work with that client beginning next week? Well, if your documentation isn't in there, then whoever is picking up that chart will have no idea what was done. So it also serves for continuity and coordination of services. It also is very critical for supervision because it proves that, one, that the supervisor was doing what he or she should do. It also serves as documentation for the employee that they were provided the supervision they needed. 5, service evaluation. It helps us to know if what we're doing is working. If it isn't working, then we need to change the plan of care. And 6, it serves as accountability to clients, insurers, agencies, other providers, courts, etc. So things to consider about documentation. Is the documentation complete? Is it concise? Is it accurate? And is it date stamped and time stamped? And when we put our services in Acorn, when we document, when the time and the date are documented on that entry. The part that you have the most control over is your documentation complete? Is it concise? We don't need to flower it up. And is it accurate? Does it really portray the work you did? Does it accurately describe what the client needs and what you or the client is going to be working on? Secondly, if a record is well documented, then it's less likely to become a liability for the employee and or the agency. Remember that any of our records can be subpoenaed. So when you document, think of how you would feel if what you wrote was being read in a court of law. What if a judge was reading it out loud? Would it exonerate you? Would it support what you've done? Would it support your decision making? All those are things to think about. And number 3, again, I can't say it enough. Sloppy documentation is equated to sloppy care. I know it doesn't mean that sloppy care was provided, but it doesn't prove that quality care was given. The 4th consideration is that what is written becomes a permanent record. So the way that it is written is going to be what any court or any future employee will assume happened, and rightfully so. But just remember, it is permanent. We cannot go back and change that. And 5, what isn't written may be questioned forever. So make sure that the story you're telling is the accurate story. It's the story you want told, and it's absolutely correct. So why timely documentation is critical? 1, it represents our clients' lives. It's a snapshot of a movie. It's a still shot of what a movie would be. So we need it to be as concise and as clear as possible. Also, the accuracy of the documentation is directly related to how soon we document after the event. And this became very obvious to me many, many years ago when we had an incident occur in one of our counties. We had a social worker who made a home visit, and fortunately, she came right back to the office and documented the same day. later in the day, that client was murdered. So, of course, everything she did, everything she saw, everything that was said immediately came into question. And I have to wonder, would she have been a suspect if she had not come back and documented? Would it have appeared that she may have done something wrong if she had documented several days later and perhaps forgot and left out a key detail? Fortunately for her, she did exactly what she should have done and came straight back to the office, documented, and had everything in place by mid-afternoon. So the patient was actually murdered after she had documented everything that had happened. So I know that's an extreme case, but it's one that has certainly stuck in my memory. I will never forget that. So I always have tried to document as close to the event as possible, especially after that happened. It also allows another social worker to provide services in our absence, whether it's a long-term absence or whether it's just a short-term, maybe you're on a break when the patient calls in. If the documentation is there and the worker who's actually handling that call can read it and go over it, then that creates continuity. It also serves as a tool to protect both clients and practitioners in the event of an ethics complaint, a lawsuit, or even in a criminal investigation. Again, I go back to the murdered patient that we had. How would that have gone down if our worker had not documented what she did in a very timely fashion? So what are some best practices for documentation? You read what you write or type. Always read it before you hit the save button. Does it make sense to a layperson? We speak a completely different language. We use different acronyms. We've got to make sure that anybody who picks up that record, again, possibly in a court of law or an insurance person or the client themselves, we've got to make sure that what we have written makes sense. You should assume that your documentation will be read by others. Do you want it read out loud in a court of law? And that's something to really consider before you hit the save button. Use proper grammar and spelling. Remember, your credibility and the credibility of the agency are at stake. Spell check or autocorrect, as I have in the next slide there, too often replaces the wrong word. For example, it's very easy to slightly misspell the word previous, and autocorrect will bring up precious. So rather than a previous PMP, we have a precious PMP. Completely changes the meaning of the documentation, and it really makes it look as though the social worker wasn't really paying attention to what she was doing. So too often the wrong words get used with serious consequences. Or, in this case, with autocorrect, perhaps it's the wrong word, but it's a word that's spelled correctly. It won't pick that up. For instance, using no instead of not, N-O-T, well, no is actually a word, and so it's going to get skipped over. So never depend on autocorrect to do anything that will possibly help the documentation to get questioned later on. Use abbreviations that are understandable in context. For example, we often see DD written as developmentally disabled, or it could also be dual diagnosis. Those are different things. Now, oftentimes within the context of the sentence or the paragraph, we know what DD would stand for. But would the layperson know? Would they be able to understand it? If you're questioning it, then please go back and write out the words. Another example is SA. It could stand for substance abuse, or it could also stand for sexual assault. And oftentimes we see those occurring together. Their substance abuse may be involved within a sexual assault, so you wouldn't want to use SA for both in that situation. Again, if there's ever a question, it's much better to write it out, rather than abbreviating. Another is AKA. Those of you who work in home health know that as above-the-knee amputation, but it could also stand for also known as. Again, if an attorney picked up that record and looked at it, would he be able to tell the difference? What about PT? PT could stand for patient, physical therapy, or pregnancy test. Now, beneath that, what we see is how they really should be written to be able to distinguish between all three of those. Capital P and lowercase t is often the abbreviation for patient. Capital P, capital T is often the abbreviation for physical therapy. And then lowercase p, lowercase t stands for pregnancy test. That's one way to distinguish it. Again, if it's not clear within the sentence, you may want to actually write that out. DO could stand for right eye, or it could be once daily when we're talking about medication. PSA, does it mean public service announcement, psychosocial assessment, or prostate-specific antigen? If you're unclear or if the documentation is not clear, then actually write out those words. Too much content, too little content, or the wrong content can harm the client, the practitioner, and the agency. So we want to have enough information to cover everything that's needed. We don't want to skip over anything, but we don't want to have too much information where it's very difficult to pick out the important parts. And we certainly don't want the wrong content, as that can harm not only our clients or our patients, it can harm us as practitioners, and it can certainly harm our agency. So commonly misused words. This is a list of words that was actually picked up out of documentation where they were used in the wrong manner. For example, quite or quiet. And again, both of these are real words, so autocorrect is not going to pick it up. Quite we often use as almost, but quiet means it's the noise level or volume is very low. Those are two very different things. Next we have there, or there. There, T-H-E-R-E, is a place. There, with an apostrophe, is the contraction of they are. And there, T-H-E-I-R, is the possessive form of they. So it shows ownership. Again, these are three very different things. So we have to be really, really careful about ensuring that we use the right word at the right time. This is another example of where autocorrect will not find these. To set or sit is often confusing. Lay or lie. And again, these are very similar, so I put them here together. To set or to lay is to place something on another surface, for example. To sit or to lie is to seat yourself or to recline. So we may set the basket on the table, but we would sit at the chair. So it's or its. Again, that can get very, very confusing. And I've put some asterisks at the bottom as a way to make it a lot easier. Remember, with an apostrophe, the apostrophe indicates that there's a missing letter. So with IT apostrophe S, that means it is in most cases. But if you can replace its, ITS, with his or hers, then there's no apostrophe. And that's for the most part. It's not always accurate, but that will help maintain that for the most part. Accept or accept. This is often confused. Accept means to exclude something. To accept is to receive. So you would accept a gift. You may accept some excuse. Breath or breathe. Breath is the air that is actually inhaled or exhaled, and breathe is the action of inhaling or exhaling. So one is a noun and one is a verb. Another one that we see a lot is then or than. Then indicates time, and than is to compare to something else. And one way to remember that is if you're talking about time, time has an E in it, and so does then. With than, to compare, compare has an A in it, and so does than. So maybe that'll help you with remembering some of those. Affect or effect. This one catches a lot of people. To affect something is to influence. Again, it's a verb. The effect is the result of whatever happened. So it's a noun. So some commonly misused words that actually do not even exist. One is irregardless. We hear that a lot. We see it in documentation quite a bit. It's regardless is actually the word. Irregardless is something that we've created, and it's very frequently used, but it actually doesn't exist. And of course, we were all taught in probably grammar school that ain't a word. So there is no such word as ain't. Please never, ever use it in documentation. Two other words that do not exist is supposedly or undoubtedly. The correct words for those are supposedly or undoubtedly. So, some points to remember is subject-verb agreement. For example, if you have a plural noun, then you need, or subject, you need a plural verb. In this particular sentence, the documents was printed. That's incorrect. Documents is plural, was is singular. The correct form is the documents were. So either it's document was or documents were. Now, Southern lingo, of course, is inappropriate for documentation, and it's so easy to write the way we talk. But we have to make sure, again, that what we document is accurate and that it reflects back on us as professionals. So it's incorrect, again, to use something like care coordinator done the home visit. The correct verbiage should be the care coordinator has done the documentation or has made the home visit. For example, the best practices, the example below, says the care coordinator made the home visit and completed the documentation. That sounds much more professional than the care coordinator done the home visit and done the documentation. So read it to yourself before you click on the save button and try to make a habit of doing that. It's very difficult to undo something that's out there. And again, it's going to reflect back on you as a professional. It's also going to reflect back on our agency. So, as an example, of course, nobody's perfect. This is how punctuation can change the meaning of an entire sentence. Now, this picture, this actually made it to publication without anyone catching this. This is on Tales magazine, and if you will read the part that's circled, there's some missing commas in there. It should say, Rachel Ray finds inspiration in cooking, comma, her family, comma, and her dog. What it actually says is Rachel Ray finds inspiration in cooking, her family, and dog. That's a completely different thought. Another one very similar to that is one that says, let's eat Grandpa, which is very different from let's eat, comma, Grandpa. So remember that punctuation, commas particularly, can save a person's life. Here are two signs that were put up, and again, it has to do with punctuation. The first one, the one on the left, has a period in the wrong place. It actually should not even be there. It should be at the very end after the word job. But what it says is, thank you, your donation just helped someone, period, get a job. It's like you're telling your donor to go find a job. When really what it's supposed to say is, thank you, your donation just helped someone get a job. There should be no period after someone. So again, just something else to look at. Are the periods and the commas in the right places? Another one over on the right, This is a very restricted toilet because it is only for a disabled, elderly, pregnant child. I've never met one of those. I doubt that you have either. So again, there's 3 missing commas. It should be for disabled, comma, elderly, comma, pregnant, comma, children. Completely changes the meaning. And this last one is a lack of punctuation may completely reverse the meaning of whatever it is you're trying to explain. So with this picture, of course, it's a picture of a squirrel who looks like it's a picture of a squirrel who's eating some pumpkin, the inside of a carved jack-o'-lantern. But the difference between the wording is simply 1 hyphen. And it becomes, is this a squirrel eating pumpkin, or is it a squirrel eating pumpkin? And again, if you look at the picture, you really can't tell. Well, that's sort of what an attorney may feel if the attorney is reading our documentation, or a judge, or a layperson, or perhaps our own patients. So we've got to make sure that what we document is accurate, that it is concise, and that it's punctuated correctly. Here's some resources that you can go to find ways of making sure that the documentation is clear and accurate. Also, the Board of Social Work at the top, that's where you'll find a copy of our social work ethics. So I thank you for joining us today.